All right, let us see glaucoma quiz and let us start this 8 questions. All right, all of the following signs are seen in the right eye of this child. So, right eye, if you see the eyeball size is more, and that is seen in a child in which there is increase in the intraocular pressure. So, cornea sclera are stretching, leading condition known as ophthalmos, and that is seen in primary congenital glaucoma, in which there is a horizontal stria known as Hab stria in the cornea. There is deep antechamber because eyeball size is more, axial myopia is there. There is increase in intraocular pressure and there is increase in the corneal diameter, but shallow nahi, it is deep antechamber. And the treatment of choice is goniotomy because there is a Barkan's membrane which is not allowing the aqueous to come out. You have to cut the Barkan's membrane by an angle surgery procedure known as goniotomy. And during angle surgery, you should see the angle by gonioscope. And direct gonioscope should be preferred in angle surgeries. Second, a 24-year-old patient has the following findings. IOP is more than 21, so it is more. On gonioscopy, out of 360-degree trabecular meshwork was seen only 90 degrees. If you are unable to see trabecular meshwork in less than 180 degree, it is a occludable angles or closed angles. So it is a occludable or closed angles. Ocular hypertension is ruled out because that is the open angle spectrum. D option is ruled out because that is the open angle spectrum. And the pressure is high, so PACS is ruled out. Optic disc is normal, answer is PAC. If the optic disc has changes in open and closed angle glaucoma, then it's a PACG. PACS means everything is normal, pressure is normal, only the angle is occludable, optic disc is normal, that is PACS. So three definition in open angle spectrum, that is ocular hypertension, that is POAG, one is normal tension glaucoma. And three in closed angle spectrum, that is PACS, PAC, PACG. A very, very important question of PG exam. Now, third one is a combination of conjunctiva and a drug, maybe pharmac question. A drug X was given and there was blanching of the vessels. Now, blanching of the superficial conjunctival vessel is by phenylephrine. Phenylephrine is a pupil dilator also. Pupil dilator, how it directly acts on the iris dilator muscle and dilates pupil. Now, which is a drug which blocks the iris sphincter receptors and dilates pupil? That is cycloplegics. That is atropine, tropicamide, cyclopentolate, homotropin. Adrenaline, phenylephrine directly acts on the dilator muscles and cause pupil dilatation. Pilocarpine is A, that is iris sphincter muscle directly acting and causing pupil constriction. Secondary glaucoma, ocular hypertension is a primary glaucoma, just I told you. That's the answer. Pseudoexfoliation, angle recession. Even if you don't know Schwartz syndrome is a pigments which is blocking the trabecular meshwork, pigments coming from the retina cells. Now, how can retina cells come into the vitreous cavity and block the pigment? In rhegmatogenous retinal detachment, there is a tobacco dust appearance. Retina pigments are coming into the vitreous cavity from the retina hole, and that can from the vitreous come into the antechamber via zonules, via posterior chamber, via antechamber and block the trabecular meshwork, causing secondary open angle glaucoma. Even if you don't know this, you should know ocular hypertension is a primary open angle spectrum. Seton is the English name of drainage device, like Ahmed valve implant, like micro incision glaucoma surgery, like express shunt, like eye stent, smallest device in ophthalmology and in body, or Zen implant. So drainage device means Seton device. Vogt striate is seen in acute angle closure in any angle closure disease. If the pupil is dilated, there is high friction between the iris and the lens. And if the friction is 360 degree around the pupil, there is a pupil block mechanism. Aqueous pushes the iris, closing the angle 360 degree, known as iris Bombay mechanism. And there will be high pressure, high IOP, shallow AC. Because of high IOP, there is iris sphincter atrophy. That's why vertically dilated pupil is there. Pigments of the iris has dispersed all of the eye. And anterior lens epithelium necrosis is known as glaucoma flecken. Iridodialysis is not a triad in Vogt striate. Now, all are changes in glaucoma, but Rohin's nasal step is a visual field change, not a optic disc change. In glaucoma, there is a ganglionic cell loss of the retina, which will lead to nerve fiber axons loss. They form the neuroretinal rim. So, neuroretinal rim is thin, so there is increase in the cupping. If there is more than equal to 0.7, it is abnormal. Increase in the cupping will lead to prominence of the lamina curvosa part of sclera known as lamina dot sign. And the nasal fibers, like radiating fibers of the retina, are most resistant to glaucoma. They attract the vessels toward their side, so there is a nasalization of vessels. Rohin's nasal step is a visual field change. Amongst all the following, which is the earliest defect amongst the following if there is an inferior arcuate fibers are involved? So it has to be superior defect. It cannot be inferior defect. That is ruled out. Central scotoma is due to papillomacular bundle fibers. That is first seen in optic neuritis, toxic optic neuropathies. The question is before cedal or supranasal paracentral, which is first? Of course, paracentral scotoma is first defect, then it joins the blind spot cedal scotoma, then arcuate scotoma, then double arcuate, like a Rohin's step, because of unequal contraction of the visual field, then central scotomas, and the last is temporal scotomas. Why? Because nasal fibers are the most resistant. So answer here is B. I hope you have done well. Thanks for watching. Best wishes.